This is your Chapter 17 bookkeeping procedures. We're going to talk about accounts receivable out of your ADA book. A couple of definitions before we get started. Accounts receivable is the amount patients owe the practice. Accounts payable is the amount that the practice owes others. Bookkeeping is our method of recording all financial transactions. Accounting is the system for verifying and classifying all transactions. Components of financial records organization. So we want to have the patient's information. This is going to identify the party that is responsible for the financials. And we also want to identify the insurance coverage. Method of recording transactions. So we can do this either computerized or manual, depending on what your practice thinks is best for them. And billing is going to include billing the patient and billing the insurance company. So billing as a procedure is just notifying a responsible party of their account status. We want to inform that party and then request payment if payment is due. And the statement that we send that party should indicate the date of service, the patient that had the service, and all the transactions. Steps in managing patient transactions include identifying patients, producing route slips, post-financial transactions. We're going to document those treatments, document payment, and complete end-of-day procedures. So for a computerized system, we'll check the patient in. We're going to ask them if they need to update the health history. We're going to make sure that insurance coverage is the same and the billing address hasn't changed. And then we'll change the status of the patient to in the office or waiting treatment. The clinical staff is going to then record the patient's treatment for that day. We'll check the patient out, and then we'll do our end-of-day procedure. End-of-day procedure includes posting the payment, post credit card payments, making any adjustments needed. We'll complete an audit report, and then we're going to track petty cash. So the day before, we're going to pull and review patients' charts. We'll confirm appointments. We're going to prepare a daily schedule and then also make copies for the rest of the staff. We will check on lab work that's due, and if needed, we will use our call list or ASAP list to fill that schedule. Routine for managing financial transactions includes the day of, we are going to produce route slips, check the schedule, review the chart with the office. When the patient arrives, we will update any information needed, so financial, medical, and insurance. When treatment is done, we will proceed with our patient checkout. We'll post any transactions and schedule the next appointment, and then we're going to process payments. At the end of the day, we'll complete posting of daily transactions, prepare our bank deposit, generate a day sheet, complete an audit report and account for all charts, and then complete any insurance processing. Some reports that we might run at end of day include financial reports. We might want to look at profit and loss statements, accounts receivable, so we want to know how much money we made that day, production reports, insurance reports, accounts payable, bank account reports, and then payroll.